Thank you for joining us today. My name is Miriam Feldblum, and I'm the Executive Director of the President's Alliance on Higher Education and Immigration. The nonpartisan, nonprofit alliance brings college and university leaders together on the immigration issues that impact higher education, our students, campuses, and communities. We work to advance just and forward-looking immigration policies and practices at the federal, state, and campus levels for immigrant, international, and refugee students. Today, an outstanding set of speakers will be discussing the challenges and barriers that international students and professionals in medicine and healthcare face, as well as the opportunities for change and actions to take. The crucial role that international researchers and immigrant medical and other health professionals have played in the pandemic has underscored the importance of a welcoming and robust immigration system. And at the same time, international students and professionals have faced significant immigration barriers related to entry and their ability to stay and work. Certainly during the previous administration, but many issues are longstanding and persist today. With the current administration, there are now new opportunities to try to effect real and necessary change. These are pivotal times for immigration reform in which we in higher education need to continue to be engaged. So what are the issues, experiences, and opportunities? We start with the legal context with Dan Berger, partner at Curran Berger & Kloot. Dan, who's a highly valued member of the President's Alliance Legal Advisory Council, is a nationally recognized immigration lawyer with extensive experience working with institutions and students. Then Dr. Rajika Bandari, a senior advisor for the President's Alliance, international higher education expert, and author of the forthcoming book, America Calling, A Foreign Student in a Country of Possibility, will facilitate a conversation on experiences and pathways with Azan Verji, co-founder of F1 Doctors, Dr. Favorit Idukundawanda, who is an assistant professor at University of Massachusetts Amherst College of Nursing, and Dr. Tafazwa Mugui, Director of Strategic Partnerships at Path AI. After which we'll hear from Dr. David Skorton, a national leader in supporting international students and professionals in the health fields, and who's president and CEO of the Association of American Medical Colleges. Rajika will then bring all the speakers together for a final Q&A. A touch of housekeeping. You can start putting any questions in the Q&A box during the session. You need not wait till the end. This webinar is being recorded and we'll share the recording with all the registrants, and it'll be posted on our website within the week. Now I'm thrilled to turn this over to Dan Berger. Dan.
Thank you, Miriam, and hello, everybody. I'm just so glad that you're doing this and that all of you are joining, because as many of you know, immigration is really just, my life is really a big game of categories. I spend my time trying to figure out what kinds of categories might be most helpful for an individual to achieve their career and personal and goals. And for students and immigrants in the healthcare field, there are more opportunities, there are more categories, but there are also more strings attached. Many of those categories do have strings attached. And I think the part of the impetus for this webinar came a couple months ago when Miriam and I were both contacted by a nursing student who was the only international nursing student in her program and was really having trouble getting advice, not only on the immigration piece, but on how to conduct a job search as an international student, how to ask for visa sponsorship, to what extent she might be able to identify hospitals or other places to work at that might understand ahead of time, so she wouldn't have to educate them. So this is, I think, this kind of understanding is really incredibly helpful. And for those of you who are from various colleges and universities around the country, you can help to work and share some of the ideas that you'll hear later from international students and faculty and others about how to support, how to really make sure that anybody in the healthcare field is able to get the information and the advice that they need. just to give you a little bit of a flavor of the variety of different kinds of situations that we end up in. When DACA first started, there was really, I mean, a lot of DACA was individual DACA students leading the advocacy, and that was it was wonderful to see back in 2010, 2011, 2012. But one piece of that were medical students who ended up really working together to create a guide for graduate medical education programs so that they could understand. You can imagine a hospital, even if it's very sympathetic to DACA students, might be nervous about committing to a 3 or a 4 or a 5-year training program for someone who has a 2-year work card based on President Obama's exercise of prosecutorial discretion. And there was a lot of discussion. There was a lot of education really that needed to happen with the DACA students who were heading to medical school or finishing medical school, and with the hospitals that may end up training them. Another example of situations that come up really particularly for students is temporary intent. We have many of the common visas that are used, such as the F1 or the J1 visa for training, do technically require temporary intent, and that policy was reinforced during the previous administration. Many people do. Many medical residents, nursing students, and so forth do plan to stay in the U.S., and it's a delicate balance of trying to manage those temporary visas, but still end up leaving the door open for permanent residence. And to give you an example of some of the different categories that are available, we give a separate talk at universities for people in the healthcare field, because the standard talk we give is more usually about H-1Bs and standard green cards, and that works for many people. But for nurses, for example, and physical therapists, there is an expedited, streamlined green card path that sometimes allows skipping the H-1B visa entirely. For doctors, there are various programs for working in medically underserved areas, and those are complicated, and the angles on those are changing. We had some good news this past year where the Federal Department of Health and Human Services has expanded its program, taking away some of the pressure on the states to support doctors working in medically underserved areas or serving medically underserved patients. And some healthcare professionals do have to go through additional screening called a visa screen. That would be medical technologists, nurses, and so forth. And just navigating that can be an extra challenge, and sometimes there isn't a lot of guidance if the students' mentors have not been through it themselves. So I think at this point I will pass it back to Rajika for the panel, but I just want to say that this is a real, I'm glad this is happening. This is a real challenge. And I think you'll see when you hear from the panelists that understanding the immigration plan and explaining it to potential employers is something that we can all help with. Thank you.
Thank you so much, Dan, and good afternoon, everybody. A good day wherever you are. And thank you, Dan, for this important overview. And I know that there are a lot of questions about many of these different topics that I hope we will get into in the Q&A. But now let me turn to our panel, where we have intentionally brought together a group of individuals for whom the concerns that we are discussing today are not only a lived experience, but are also issues for which they are now advocates and to which they lend their voices in different ways. And in getting to know them and learning about their backgrounds, I've been really struck by the fact that many of the challenges that both international students and skilled immigrants in the US face are not new and have persisted for a very long time. And I know this well because I experienced them as well and have and as have thousands of others. And I also talk about them in my new book. But the challenges that international students and foreign-born workers in the medical field face today are unique and complex for many of the reasons that Dan laid out for us so well. And so it is these that we are really focused on today. So let me now briefly introduce our panelists. I invite them to turn on their cameras so they can join me. And you can feel free to read their detailed bios in the chat box. I'm going to introduce them very briefly, but you can certainly learn much more about them through the link. Dr. Favorit Iradukunda is an assistant professor in the College of Nursing at the University of Massachusetts Amherst and has been educated in Rwanda, South Africa, and the US. Dr. Tafadza Muguwe is a clinical instructor in medicine at Harvard Medical School and a hospitalist at Mount Auburn Hospital. He's also the director of strategic partnerships at Path AI, a company that is advancing personalized healthcare through AI-powered pathology. Originally from Zimbabwe, Tafadzwa has been educated in the UK and the US. And then we have Azan Zahir Virji, who is a second-year MD, MBA candidate at Harvard Medical School and the Harvard Business School, and the co-founder of F1 Doctors, a web-based mentorship platform that connects non-US applicants to mentors and health professional schools in the US. Originally from Tanzania, Azan also holds degrees from Yale. So I think you'll all agree we have a wonderful, diverse panel here, and I can't wait to jump into our discussion. So to get us started, let me ask sort of an overarching question to that I'd like all of you to address briefly. But Tafadzwa, maybe we'll begin with you. Based on your personal experience and your professional work, what do you think are the top 2 or 3 barriers that international students or foreign-born workers face in American healthcare and medicine today?
That's a great question, and thanks, Rajika, for the opportunity to be part of the panel. It's an honor. So I've been in the medical field for, the last 10 years since finishing my training. I think what I see as key barriers when I look back on my journey is just really, number one, understanding the space from like an immigration and kind of documentation standpoint, and then navigating that space. So I would say that's the biggest, and I would maybe say a related one really is institutional support. And so I think with the first one, in understanding and navigating the space, I think my fellow panelist who is in med school here could probably tell you, when you land in this country, either for college or before medical school, and you're thinking about going to medical school, what's on your mind is, will I get into med school? And what you are hearing and what most people believe is that it's actually nearly impossible for an international student to get into med school, that's just the perception that we all get in and hear, and kind of what we learn from people around us. And so those of us that you have seen kind of go through this training and apply to schools and make it to the end of the tunnel, it's only because we couldn't imagine doing anything else. And we had to find a way. But what's missing when you come in is just the knowledge of, okay, is it really impossible? Or are there actually things that you can do? And are there actually institutions that can support you? And there are actually opportunities for you to be able to navigate this and actually turn out okay. And so when I look back, I feel like those things are what we're missing.
Thank you. Azan, should we move to you with the same question?
Yeah, thank you so much, Rajika, for inviting me to this panel. It's such a privilege to speak to all of you. And yeah, I think it's a pretty good transition over to me. As someone who just got into medical school and who's just been through this process, I would say the biggest challenge is probably when it comes to financial support.
They're good girl.
In my opinion, as somebody who is a low-income student from Tanzania who doesn't have a lot of financial resources at his disposal, I really struggled to find the means to actually attend medical school, right? The dream was there, the ambition was there, the experiences were there, but just the financial barrier was so large that at many points during this process, I actually considered sort of giving up on this dream and taking an entirely different path. So I strongly believe that that's by far one of the biggest barriers that exist and one that needs to be alleviated. As of now, for international students, even if you do get into medical school, the next step of actually attending medical school is just a whole nother issue. It's a whole nother step that needs to be taken. And when you try to search for resources out there, there's very limited options for scholarships. Many of them will say they're only for US citizens. And if you look for, loans, a lot of them will be either private lenders or banks, and the interest rates on those are ridiculously high. And so at the end of the day, you basically are at the mercy of the medical schools that have large enough endowments that they can provide some form of financial aid to you. And there's just a very limited number of those schools. So if there's any way that we can sort of alleviate this barrier that currently exists, I think that is what will definitely attract a lot more international students who come here for college to pursue the medical field.
Thank you. So you've both raised sort of two really important but also distinct points that we'll get into further as we continue our discussion. Favorit, let me turn to you from your perspective, the top 2 or 3 challenges.
Thank you, Rajika, and thank you, everyone. I'm so happy to be here. I think it's the same challenges. I'm looking at my notes and I'm like, they've already said everything, and it's really for nursing students and other students in the health profession field or disciplines. The lack of funding is a huge barrier. But also the other challenge is that a lot of admission requirements are sometimes or most of the time they're tailored to the US education system. And so sometimes it's very difficult, at least for nursing students, to get from high school in their country to coming here and getting into a nursing school because of the education system and the admission requirements, that are tied to the US education system. Another thing that is a challenge that is very specific to nursing is that there is still a lack of understanding for parents and funders and people who give scholarships in general. Sometimes, a lot of times, they don't understand the need to invest in educating nurses and educating nurses at a higher level. And so because of that, students who want to pursue nursing in a US-based college, they don't really get those funding opportunities because people don't understand, why are you going to a foreign country to pursue nursing? Why is it so expensive? And so there is a need to, for its owners, really, its own nurses to, clarify that to governments and other funders and talk about the need for investors to invest in nursing education and funders to fund nursing education. I actually faced all these challenges combined 13 years ago when I was trying to get into a US-based university. When I graduated from high school, and I was a really good student. I was so excited. I wanted to come and pursue my nursing education in the US. And all these challenges, funding, the lack of understanding of, my transcript and my education system, the lack of understanding of why do you need to go and pursue nursing in the US? There is nursing here. All those things combined made it impossible for me to get into a US nursing program. And I really wanted to do nursing. And so I was offered some other option, but I decided to stay in Rwanda and pursue my nursing education there. But that was a disappointment for me.
Thank you for sharing that, Favorit, and sort of what the challenges are for that educational pathway. And this is actually a good segue into a more focused question that I want to ask you, because you talked about sort of that lack of recognition of the value. And I think the reverse is also true, that in the US, in healthcare, so much of the attention seems to be skewed towards physicians and foreign-born physicians in the US and their value. But in fact, nurses are absolutely critical to the healthcare endeavor. And we've certainly seen this through the pandemic. And in fact, nurses make up 16%, foreign-born nurses make up 16% of the entire nursing profession in the US. So sort of moving on from the student pathway, could you speak a little bit to what you think are some of the unique challenges that nurses or even other healthcare workers who are not physicians face in the US?
Thank you. So there is a lot of challenges. I'm just going to name a few. And one of the biggest challenges is for those who come here and they already have a nursing degree that they obtained in a different country. One of the biggest challenges is the registration process. The registration process is very complex. It's very difficult to understand. It's very difficult to navigate. Different states have different requirements. And on top of that, it's very expensive. And so these make it impossible, very difficult for those who are already qualified to get registered. And because of that, either it takes them years to start practicing as a nurse. So we have nurses who are sitting at home, they are qualified, but they can't practice because they are not registered. Or they end up practicing below their level of education. So you have a nurse who has a bachelor's degree, but because they can't register as a nurse, they decide to work as a nurse assistant. And so that is a very, very, very considerable challenge. And then another challenge is what you kind of mentioned in the question is, we have a lot of immigrant nurses, they are in academia, they are educating nurses, they are doing research, they are providing care in hospitals, but we don't really hear about them. We don't hear from them. And because of that, the lack of recognition, it just contributes to them lacking support, not having the support they need. Because if we don't talk about them, if we don't talk about the impact that they are making, then they don't get all the support that they need. And because of that lack of support, those nurses like me who are in academia lack opportunities for funding to do research if they're interested in doing research. Because a lot of funding for research is for US citizens or permanent residents. And so for, most or many nurses who are immigrants and they're working and they're doing research, they lack support. Those who are in education, sometimes they lack encouragement to use their specific skills to diversify the way they teach. They are not encouraged to bring those special skills that students could benefit from, that they acquired in their previous education if they were educated elsewhere. And those who are in clinical, they really face multiple barriers. The first one I've already mentioned, that is the registration process. And one of the other biggest challenges, the challenge that Dan mentioned, is the lack of sponsorship. You know, if hospitals sometimes don't sponsor them, and they don't sponsor them to get visas, and because of that, again, it goes back to people struggle to get jobs when they are already qualified to practice as nurses, and a general lack of understanding of the immigration process. So again, like I said, I could go on for days, but what I wanted to say at the end is that we have a huge immigration population. We need these nurses to provide care. And so we should really be working together to make it easier for them to get into the system.
Thank you. Thank you for that very evocative statement. And I think one of the really important takeaways also, I think, for colleges and universities in the US is the point that you made about research that's done by those in healthcare and medicine who are not doctors, and is that research receiving adequate an adequate focus and acknowledgement. Let's move on really quickly. Azan, I want to move to you. So one of the points I think that's been made thus far is this real gap in knowledge and gap in understanding the whole system. And I think that really speaks to what you're trying to do with F1 Doctors. So tell us a little bit about it. What was the motivation behind founding F1 Doctors, and what are you trying to do through your organization?
Sure, would love to. That's a great question. So F1 Doctors has truly been a joy to create. And we have been really fortunate to be featured in a number of different news agencies as well. But to give you a little bit of story, a little bit of history, the impetus of starting F1 Doctors came from my own personal experience. You know, I came to this country almost 8 years ago with the dreams and the ambition to be a doctor. But I realized very quickly, even in college, that my path would be an uphill battle, that there were not a lot of financial resources, not a lot of support that was available, and I had to navigate the system on my own. And so I figured it out eventually. I had a couple of mentors who were US citizens who would guide me with their path, and then I would try to tailor it to what the international experience would be like. And eventually, when I got into medical school, I actually vowed to make this process easier for those who come after me. People with similar dreams and similar ambitions, and ensuring that they don't feel alone through this process. And that's exactly what F1 Doctors does. It was founded in the spring of last year, and we've grown exponentially. In just over a year, we have almost 134 different mentors from all different health professional schools, from nursing schools, PA schools, DMD, MD mentors as well, from 44 different countries, and we've served over 800 students. And we're an entirely free platform. And the goal of what we do is just to ensure that students hear our stories, hear our experiences, learn from some of our mistakes as well, make sure that they feel supported through the entire process. And at the end of the day, what we're doing is we're really trying to increase the visibility of international students in healthcare and in medicine. The fact that we exist, we're not a myth. We've been through this process, and we are here to help. All of our mentors are doing this voluntarily out of the goodness of their own hearts, because we know how hard this process is. And it's all of us have this wish to simply give back to others just like us. And the question remains as to like what value we all bring to the field of medicine and healthcare here in the United States. And if you ask me, when any of us on this panel were to serve a patient, we bring diversity to the field of medicine and healthcare, right? The US healthcare population is changing drastically. And it's a known fact that when you have a physician or a nurse who's taking care of you, who understands your culture, who understands your language, they're more willing to actually take on some of the advice and guidance that you give them. And we are trying to increase the visibility that we exist, and also support others to follow our paths, to come into the field of medicine and healthcare, and to be able to serve the US population if they wish to. That's rapidly changing as we speak. So that's sort of a story of F1 doctors. And I'm so privileged to be here and honored. And hopefully a lot of the institutions that are here will be able to share this resource with a lot of their students.
Thank you so much. And, you know, in the lead up to this, a lot of people submitted questions on this information gap and where is more information available, who can help. And I think you just helped address some of those questions. I think your last point about the diversity of the healthcare profession needing to match the face of the changing US population is a really important one. Tafadzwa, let's move really quickly to you. Your articulate commentaries on the intersections of race, immigration, and education have appeared on WBUR, Boston's public radio station, and one is titled "A Dual Degree from Oxford, a Medical Degree from Harvard, Neither Protected Me from Racism." From your perspective, what are the unique challenges that international students face, particularly for those who are from the Global South and who belong to, or those who belong to racial minority groups in the US? And what sorts of immigration reforms are needed to make it easier for international students and foreign-born healthcare workers to succeed in the US?
Yeah, no, that's a great question. And yeah, those are very, very weighty issues. I'll try to be brief. And I think the key for me there, you mentioned the word intersectionality. And I think when I came into this country and as I was kind of going through my journey, this definitely wasn't top of mind. But the idea that as a Black or brown person from the Global South, you have that identity, at least you are perceived a certain way in society, whether you realize it or not. And so the first thing is really that the societal attitudes that have inflicted Black and brown brothers and sisters who were born in this country, who have lived their journey in this country all their lives. You're not spared from that. You are just you're automatically seen in the same way. So I think what happens when you're coming in as an international student is you, at least in my case, I was ignorant of that aspect of things and really leaned into the other challenge, which I think Azan has really kind of gone into in depth here, which is navigating the system, knowing that resources are limited, knowing that you don't have enough information, knowing that it's not going to be as easy. I mean, it's going into medicine, going into health professions, dental school, nursing. It's difficult even if you're an American citizen. And so trying to navigate all of that, I think the intersectional piece is that you're navigating your immigrant identity and your kind of immigrant challenges. And that's the primary thing. And I think for me, the awakening, as you saw in the essay, was that over time, I became aware of this other reality of being a Black person, let alone being an immigrant. And so these two things are compounding, in my view, and are real issues to think about and to try and help our international students navigate. You asked what I think might make things better for international students. And I think for me, the dream is if getting into medical school, if getting the financial support, if getting all the tools and the resources you need to achieve your dream wasn't modified by being international, because that makes things 10 times harder in a process that's already really difficult. And so again, my colleagues on the panel had mentioned that it would be great if we can have, even more resources. I think we get a lot of support as it is, but it's still incredibly difficult. And I just wish it was even easier than it is.
Thank you for that. And I would encourage everyone to go on to the website, and Miriam's just put a link, and read some of the Fadzwa's incredible essays. So very quickly, and this is, I want a very, very quick response from each of you. My last question to each of you. You all have an intimate connection to US medical colleges and higher education, either as current or former students or as faculty. what do you think US higher education institutions can do to ease the path for people like you? So just very quick responses. Let's start with you, Favorit, and then we'll work our way over to Azan and then finally to Fadzwa.
So making sure that we are supporting students, availing resources about immigration, resources that are easy to understand. We've already talked about funding, really funding. And the last one is, as what Tafazwa just said, is being an international student can be a lonely journey, especially if you're in the health profession. It doesn't have to be that way. So creating communities and making sure that our students' mental health, emotional health is supported as well.
Thank you. Azan?
Wow, there is nothing more that I can add to that. That was a perfect answer. Funding is so important. I'm going to say it again. Also, ensuring that individuals actually have access to all these resources and they're actually readily available on these institutions' websites, right? So if you're an institution and you're saying openly that we welcome international students, making sure that on the back end, you have all the support for them, right? When it comes to immigration challenges, when it comes to mental health, emotional health, all of that, ensuring that they have, they're able to navigate simple things, just anything as simple as like, getting a cell phone, getting a bank account, credit scores, all that financial knowledge that you need to really thrive here in the US long-term. All that information must also be readily accessible to these international students, something that all of us take for granted. International students, you have to realize, often come with none of this knowledge. So you have to be putting in the time and the money towards educating them.
Thank you. And Tafadzwa, your final words on this?
Yeah, and exactly the same thing, maybe in slightly different words. I mean, what I might say, I think I see this as a blind spot in a lot of institutions, and it's blind spots. We all have them, and I think what it is you give a student a full scholarship, right, and then you stop there, and that's great. But I wanted to say, every additional dollar after that is not a diminishing return on your investment, because it could mean the difference between a student, spending 20 hours a week, on a campus job instead of really, applying themselves, academically and socially on campus. And so actually the returns don't diminish after the full scholarship. They actually start to magnify, because you actually start to really impact their day-to-day existence and experience of college life, or whatever environment they're in. So I say, bring on the resources, and thank you very much to the institutions that have actually done that in our lives. Thank you.
Wonderful. And that's a great note on which to end this wonderful discussion. Thank you all so much for your insights and really bringing your candid thoughts and ideas to this discussion. So thank you so much. And we're now going to move on, and it's my immense pleasure and honor to introduce Dr. David Scotton, who's the president and CEO of the Association of American Medical Colleges, AAMC, which represents the nation's medical colleges, teaching hospitals and health systems, and academic societies. Dr. Scotton has had a distinguished career in government, higher education, and medicine, and some of his roles have included serving as the 13th Secretary of the Smithsonian Institute and as president of both Cornell University and the University of Iowa. Trained as a cardiologist, Dr. Scotton has focused on issues of diversity and inclusion throughout his career. A nationally recognized supporter of the arts and humanities, as well as an accomplished jazz musician and composer, Dr. Scotton believes that many of society's problems can only be solved by combining the arts, the arts and humanities, the social sciences, and the sciences. And I could not agree more with that. Ever since joining AAMC in 2019, Dr. Scotton has addressed social issues that affect health, guided the AMC through a pandemic, and worked tirelessly to make academic medicine more diverse, equitable, and inclusive. And given the issues that we're talking about today, I can think of no better person to share his wisdom with us today. So Dr. Scotton, over to you for your brief remarks.
Thank you so much, Rajika, and thank you, everyone. What a fascinating discussion. And honestly, you've just heard from the people who are going through or have gone through the experience. And I'll try to add a few thoughts, but the main thing is to listen to the people who actually have the experience. But I'm very glad to be able to join you in this discussion, largely because I feel so strongly that our country and all countries are stronger because of the contributions of those from other shores and other cultures. And I believe that health professionals from other countries play such an important role in safeguarding this nation's health and well-being, and as one of the distinguished panelists said, increasing the diversity of the nation's healthcare and scientific workforce. A lot of the work we do at the AAMC is central to what this conversation is focused on today. And it is true that in our strategic plan, we have a major focus on equity, inclusion, and diversity, strengthening the nation's med ed system and commitment to medical research. And the last point about diversity is especially important. And I'm just going to lead us into a quick discussion about workforce shortages in the US, ironically. And last week, I had the honor of testifying at a Senate subcommittee hearing on topics related to the healthcare workforce. Diversity has been widely recognized as key to excellence in academic medicine. There's no question it improves our physician and scientific workforce. And immigrating physicians and medical researchers bring unique cultural perspectives to the workforce, not just based on the nationality, race, or ethnicity, but the intersectionality that was mentioned, and also regarding the immigrant experience. So if our goal is to improve the health of people everywhere, which is our mission statement, we cannot ignore the vital role of health professionals from other countries across clinical care, research, and medical education. One example is the Conrad 30 public health immigration program, which I'll touch on, Rajika, very briefly in a moment. The US healthcare workforce and the patients we serve rely on physicians and researchers from other countries. As you all know, about 18% of physicians practicing in the US identify as foreign-born, and over half of the current postdoc researchers in the US, over half, hold temporary non-immigrant visas, including biomedical researchers who fill a really critical need in the US labor market by providing specialized knowledge and skills in the development of innovative and cutting-edge biomedical research. This kind of research over the last 15 years or so is what led to the idea of mRNA vaccines. And so that's a huge contribution that our colleagues from around the world are making as part of our workforce. Nationwide, the physician workforce shortages show just how much we rely on this vital part of the workforce. In 2018, the United States had a shortage of almost 15,000 primary care physicians and almost 7,000 behavioral health physicians, psychiatrists especially. We project this shortage will grow to between 54,000 and 139,000 by 2033, depending on a variety of assumptions of factors affecting demand and supply. But that's not all. If there were health equity in the country, that is, if everyone had the same healthcare access and the same utilization rates, regardless of race and where they live and where they have health insurance, we estimate the country would need an additional 74,000 to 145,000 doctors today on top of the projected shortage. This, of course, is just unacceptable. At the same time, as you've talked about, and as we're all aware, unfortunately, international students face incredible challenges when applying to attend US medical schools. In the Q&A box, my colleague Matt Schick, who is Senior Director for Government Relations at the AAMC, in answer to an anonymous question, has put in a link to some information that we have for international students applying to med schools. And you've also heard some terrific advice today. Unfortunately, as you know, just a minority of American med schools accept international applicants. Some states have policies prohibiting international applications to state-supported schools because states tend to support in-state applicants who may be more likely, in their view, to stay and work in their state. And schools have, as you know, have strict financial requirements for international applicants. I'm sorry to say these are more stringent than for US-based applicants. And international students are not eligible for American student loans, and often, as you know, must secure private loans. There are also many administrative challenges which have been mentioned. We also know that the vast majority of immigrating physicians enter the US for graduate medical education, required, as you know, for independent medical practice in every state. So while only about 1% of matriculating med students are international in the US, 29% of medical residents are from other countries. And they too face challenges because of the very short time frame between getting matched to a residency program, typically in March, and when those programs start on July 1. 4 months or less leaves little room for any federal delays to process and approve immigration paperwork, which are becoming more frequent. So to address these challenges, the AAMC advocates for federal policies that facilitate increasing the US physician workforce. This includes a strong plank on a balanced approach to immigration and citizenship policy, one that prevents so-called international brain drain while attracting and retaining individuals where they're needed. We've championed the DACA program for the contributions of the nearly 30,000 healthcare workers and about 200 med students and the diversity of the experience. And finally, as part of a balanced approach to increasing physician immigration, we strongly advocate for increasing something called the State Conrad 30 J1 Visa Waiver Program. Conrad 30 allows physicians to remain in the US in an underserved community after completing medical residency on a J1 so-called exchange visitor visa, the most common visa for graduate medical education, otherwise requiring physicians to return to the home country for at least 2 years. Over the last 15 years, the Conrad 30 program has brought more than 15,000 physicians to underserved area that's comparable, if not a bit more, than our own National Health Service Corps. So we're recommending and advocating to include Conrad 30 expansion and improvements in forthcoming immigration reform, and we have endorsed the bipartisan Conrad State 30 and Physician Access Reauthorization Act and would welcome your support if you feel so inclined for this important legislation. Your voice as academic leaders can have a big impact. So thank you, Rajika, for a chance to share a few thoughts, and I'm glad to take some questions.
Thank you so much, Dr. Scott, and we really appreciate your remarks and for sharing all of the efforts and changes that are underway to smoothen the path for both international students, but also foreign-born workers. So we'll start with some questions. I actually have a couple that I wanted to pose, and I'm going to invite all of our speakers to turn on their cameras now because we'd like to include all of you in the discussion. And I'm actually going to start, Dan, we're going to go all the way back to you. I know you spoke at the top of the hour, but I want to go back to you with a specific question that I don't think we've touched on yet. And I know it's of interest, and that's relating to OPT, because of course, all international students are very concerned about OPT and its prospects. But can you talk a little bit about the prospects of obtaining OPT for recent graduates in these fields under the current policies and a related question is that, is it okay for students who completed their degree to take classes for admission to med school while on OPT? So I think in general, sort of the questions are around the status of OPT and medical students.
Thank you, Rajika, and thanks everybody. So to answer the questions, OPT is still alive and well, and the President's Alliance had a webinar within the last couple of weeks inviting schools to participate in an amicus brief. There are some challenges, some legal challenges still to OPT after all these years, and higher ed is actively pushing back on that and trying to make sure that OPT remains a vibrant option for a long time. yes, students can take classes on OPT. It's hard to simplify anything in the immigration world, but in general, one is allowed to study on a work visa. Working on a student visa is much more complicated. So taking classes during OPT or while on H-1B or J-1 is okay. And in terms of the applicability to healthcare fields, OPT, post-graduation work authorization for F1 students, is available for everybody pretty much for a year, and then for 2 more years for those in STEM fields. I think a lot of us would agree instinctively that all healthcare fields should really be considered STEM fields. Most healthcare fields are not on the list currently. So we strongly advocate for adding all healthcare fields to the STEM list, which could be done relatively easily by the Department of Homeland Security. And I'll just share one more link here, where we put out a report recently on supporting international entrepreneurs, and one of our arguments was, please add the 2 years of STEM OPT for healthcare professionals so that they would have the opportunity. Some will go on to treat patients, some will go on, as was mentioned, to be involved in research or really innovative startups, and we want to encourage that.
Thank you so much for shedding more light on that, Dan. So one of our attendees has asked a very broad but a very complex, a seemingly simple question, but it's not simple. And I'm going to invite thoughts from a couple of you, but actually, Dr. Scott, and I want to begin with you because I know we may lose you soon. And the question is, can you talk about the relationship between coming to the US as an international student and immigrating to the US? And I know you've all touched upon the immigrant angle in different parts of your remarks, but I think this question gets deeper into it. So Dr. Scott, if we could begin quickly with you. And then after that, I'm going to ask Tafadzwa to address this question, please. Thank you.
Well, of course, thank you, Rajika. Of course, our colleagues will be depending on help, usually from the institution where they are at. And that's going to vary a lot, institution to institution. Because we have experts like Dan to help us, unfortunately, we don't have that in every single institution. But because we are focusing at the AAMC and in many of the institutions represented here on a holistic view of the importance of immigration in general, I think those two things can go together. Can't give you anything more specific because it's going to depend on every single individual situation, but it's a very important thing to bring them together.
Thank you for that, Dr. Scott. And Tafadzwa, let's go to you, since you have yourself personally, if I'm not mistaken, also followed that path of higher education to becoming an immigrant. So would you like to tackle that question on what that relationship is?
Oh, can you repeat the question for me, Rajika?
So the question is, can you talk about the relationship between coming to the US as an international student and immigrating to the US?
Yeah, so yeah, came here on a institutionally sponsored F1 visa, which I carried through my medical training and also used kind of OPT. And then in residency training, what happened was I was sponsored to use a H-1 visa. I think it could have been a J, but my institution sponsored me to be on an H-1 visa, which puts you on a path to permanent residence. And so that's yeah. So I'm currently a permanent resident.
Thank you. And maybe I'll just add to that, if I sort of understand what the question is also getting at, that of course the US attracts just over 1 million international students, and many of them do stay on and become skilled immigrants. but many don't. And the ones who do stay on and follow that pathway of legal immigration that the Fadzwa just described contribute to the US in many different ways, but many also go back to their home countries and are really critical in helping the US sustain international collaborations with the rest of the world. So again, it's really a win-win situation when it comes to international students, regardless of what their future paths might be. We have very little time left, so I'm going to go to a question that's come up about language. And the question is, Nancy Wood asks this question: what are your opinions about or experience with English language proficiency testing for medical professionals? And what needs in terms of English language development aren't being met? So again, sort of the role of English language, and I know that that Matthew from AAMC provided some information on this, but I wondered if the panelists would like to weigh in on how to make language issues less of a barrier. And I will open it up to whomever wants to chime in first.
I just wanted to say that, after I finished my PhD in a US-based institution, when I was registering to actually moving my nursing registration from one state to another, I had to sit for an English test. And that was these tests are very expensive. And in this case, it was not really necessary. I had just graduated from a US institution. And so that for me shows a lack of collaboration between these boards of registration and institutions. And so I think knowing when these tests are necessary, knowing when they are not. I think that's something we really need to think about.
I'd also like to echo the same sort of sentiment. While I was applying to medical school, I'd been through college here. I'd also gotten a master's degree. And then you have to sit the MCAT exam, which is an important component of applying to medical school. And I recognize it's a standardized test that requires, everyone to take it so it can standardize everybody who's applying to medical school, regardless of where you come from. But I, as someone who, I've done a lot of my education in English, but I still don't have sort of the same proficiency as students who've gone through high school here and who have, learned how to write essays and, done a lot of reading comprehension. So the CARS section on the MCAT, which is the critical analysis and reasoning section, was by far one of the hardest things. So as an international student, you may have the knowledge on biology, on chemistry, on physics to be one of the best doctors possible. But when we're creating exams or barriers that include a lot of English language proficiency that a lot of us may not necessarily have the knowledge or the background to excel at, we're automatically going to be putting some of these students behind in the process. So I think that's just something to consider when we're thinking about standardized tests, or when we're thinking about what exams do we really need to accept in international students. We need to make sure that they're not sort of putting international students at a disadvantage.
So if I could comment just quickly, Rajika. This is a really important point that our colleague makes. And we spend a lot of time looking at the MCAT for all these different reasons, because the standardized test can cut many ways, that's for sure. And that's an important point that you're raising. Of course, the ECFMG, as our colleagues know, requires an English test. So there are, unfortunately, barriers to be jumped. I do want to say that, and I'm going to take back this conversation to the folks at MCAT and again, bring this up with them. I promise you I will do that. As my colleague Matt Schick put in the Q&A, we believe also that a physician who speaks multiple languages is a big asset to the healthcare workforce. And please, the colleagues, not so much on the panel, but the attendees, influential people, please note that the Health Equity and Accountability Act has not been reintroduced into this Congress. If it is reintroduced, then we will do advocacy on our parts and hope that you will think about it in yours as well. And I apologize, Rajika, that I have to go for this 1 o'clock presentation, but it was an honor to listen to all of you and to meet you. And congratulations on all that you're doing.
Thank you so much, Dr. Scotton, for joining us. Thank you very much, and for those wonderful final remarks on your part. We are almost at the end of this event. We don't have time for more questions. And before I turn it over to Miriam to end this event, I want to thank all of our wonderful speakers and panelists. And Miriam, can I invite you to join us now?
Absolutely. Thank you so much to all the speakers. This was an amazing conversation that shows the importance of both engaging actively in immigration policy, affecting change, trying to make a difference, and the importance of institutional action, right? What we can do on our campuses, but also what we need to do nationally and federally. So wonderful. Thank you, Rajika, for leading the conversation. Thank you, everybody. Just want to note there will be an evaluation form that pops up when we leave. Please fill it out. We love to hear from you, your priorities, your issues. We want to be as responsive as possible. So with that, we'll say goodbye. Thank you so much.